Hi, Paul Sakis, Good News Broadcast, and Pause the World for Peace. We're going to learn a little about a very important issue. Actually, we're going to talk about the a problem, cancer, more concerning cancer. And I don't know if our audience knows, but the sixth most common cancer in this country is mostly it's bladder cancer, and most people are diagnosed, and about 75% are NMIBC, which stands for non-muscular invasive bladder cancer. And not everyone responds to the standard type of treatment for NMIBC, which may lead doctors to recommend surgery to remove the bladder. We don't like surgery unless you got to do it. A different treatment approach, a different treatment. All right, listen closely. May offer people with this type of bladder cancer more time before having considered this radical type of surgery. We have Dr. Larry Karish. Which one's the doctor?
It's me. I'm the doctor.
And who's the patient? Our patient, Mike.
That would be me.
All right. Well, we're doing good so far. All right. And I applaud both of you. And I'll tell you, especially Mike, for coming out and talking about an illness that you've had to live through. So here's my first loaded question. Okay. First of all, where is the bladder in the body? How common is bladder cancer? Who typically gets it? And what symptoms should we be looking out for? I think, doctor, why don't you help us out here?
Okay, well, you asked where there's a bladder. Well, it's sitting behind your pubic bone. And the about 83,000 patients will be diagnosed with bladder cancer in the United States each year. And as you mentioned before, it's the sixth most common cancer. It's the fourth most common in men, so it occurs more in men than women. And about 75% of the patients at the time of diagnosis will have NMIBC, which you mentioned before, and it's non-muscle invasive bladder cancer. And it's a cancer that grows in the lining of the bladder so that it has not yet invaded into the muscle or outside of the bladder.
Uh-huh. Okay. And what traditionally has been the treatment for a high-risk early forms of bladder cancer, or NMIBC, and how is that changing? And I'll ask one other thing. And how will you start to have pain in the bladder? Or where does it, what happens?
Well, some of the symptoms, the key symptom is seeing blood in the urine.
Oh,
So that it can be a cherry red color, it might be rosé color, burgundy, even cola colored. So that's really the hallmark symptom. But you can have some painful urination, urgency and frequency of urination. Those can be associated. But I would say that seeing blood in the urine is probably the key symptom that you're going to have.
now, did I hear you say that men
And
are more the potential of men having this bladder cancer is more than women? And women have bladders
yes,
too,
it
right?
is. Yeah, women can get bladder cancer too. And we know that there are risk factors like cigarette smoking that can increase your risk of getting a bladder cancer, environmental issues, toxic chemicals that you might be exposed to. But the traditional treatment has been BCG, which is a weakened or attenuated bacteria that's used for the tuberculosis vaccine. But about half the patients who receive the BCG treatment will have a recurrence within the first year. And when that happens, the next best treatment is to consider removal of the bladder or cystectomy. And we have a newer treatment now that's produced by Ferring Pharmaceuticals, who we're here on behalf of today. And it's called Adstiladrin, and it's a targeted gene therapy. It's the first and only FDA-approved
Great.
gene therapy,
That's super.
uh,
It's
and
wonderful.
that's given in the bladder. Yes. Mhm.
Okay, and so how do is it a pill or is it a shot? How does it come into
No,
it?
it's a liquid that's placed into the bladder through a catheter, and it's given once every 3 months, and it can cause some urgency and frequency of urination, as well as some fatigue and maybe even some blood in the bladder. So if you have non-muscle invasive bladder cancer that is not responding to BCG, then speak with your doctor about whether this treatment is right for you. And you may want to visit the website at Adstiladrin.com, ADSTILADRIN.com for more information regarding this new targeted therapy, this newer therapy.
So, Mike, how did you find out that you had this concern? And how are you doing now? And thank you for being on.
Oh, you're welcome. It was about 8 years ago. I was using the restroom at my office, and I noticed blood in my urine. This was shocking. I had never seen that before. I called my wife, and she recommended I see the doctor as soon as possible. They felt that I may have cancer in my bladder and referred me to a urology center in Colorado. They found a tumor, and I was diagnosed with NMIBC, the most common form of bladder cancer. Soon after the BCG treatment, they found that tumors had recurred. Being diagnosed with NMIBC was nothing compared to the devastation I felt when the doctors told me that I was no longer responding to BCG treatment. They did present me with the next best treatment, which was surgically removing my bladder. The thought of losing my bladder was terrifying, and I raised concern with the doctor. Fortunately, he offered me the opportunity to participate in a clinical trial using an experimental gene therapy treatment. All I had to do was visit the urologist's office once every 3 months for administration directly into my bladder. And because it's gene therapy, I had no side effects, and I continued to work with no impact on my day-to-day life. I completed the process, and my urologist, Dr. Karsh, told me that there were no more tumors. And this gave my wife and me an enduring sense of hope, knowing we could continue doing the things we love. The experience may not be the same for everyone, but this was mine, and I am forever grateful. The gene therapy I was treated with is now approved by the FDA, and it's available to others. Finally, I'd like to echo Dr. Karsh's words that if you see any abnormal symptoms, seek medical care.
That's great. And there was a website. Why don't you share that again? And are you going out skiing out there in Colorado now? You feeling good?
Sure am. I just skied over the weekend. Not with Mike, but you're out there and being physically active. But it's very rewarding to see the results that have occurred with Mike, and he's still able to keep his bladder, and he's disease-free. So it's very rewarding.
That website one more
is.
time. One more time, doctor.
At Adstiladrin.com, ADSTILADRIN.com.
Beautiful.
And speak with your doctor to see if this is right for you.
This is serious stuff, and it's great to hear some new thoughts about how to handle it. And all the best. I'll see you soon. Thank you.
Thank you.
All right, thanks a lot.
Okay.
Take care.